How to fill an oral surgery case sheet. Hello everyone, this is Dr. Baqir Ghanim Murrad with a Ph.D. degree in oral and maxillofacial surgery. Welcome to my channel. In this video, I will explain how to properly fill an oral surgery case sheet step by step. Let us start from the top of the form. First, patient information. Record the patient's full name, age, sex, address, occupation. These details help to identify the patient and may provide useful information related to their condition. Second, chief complaint. This is the main reason why the patient came to our clinic. Write it in the patient's own words whenever possible. For examples, pain in the lower right back tooth, swelling in the left cheek, broken tooth, or difficulty in opening the mouth. Specify whether the complaint is pain, swelling, or another problem. Third, history of the present illness. Describe briefly the history of the current problem. Include when it started, duration, severity, progression, any factors that worsen or relieve the symptoms. Previous treatment taken for the condition. For example, the patient complained of severe pain in the lower right posterior region for 3 days. The pain is continuous and aggravated by chewing. Fourth, past dental history. Record any previous dental treatment such as extractions, fillings, root canal treatment, orthodontic treatment, and the previous oral surgical procedures. Fifth, medical history. Ask the patient about systemic diseases and medical conditions. Check for hypertension, diabetes mellitus, heart diseases, thyroid disorders, bleeding disorders, epilepsy, respiratory diseases, gastrointestinal diseases, liver diseases, kidney diseases, HIV, AIDS, artificial implant or prosthetic joints, previous hospitalization, and also ask about smoking habits, drug history, allergies, and pregnancy in female patients. These questions are very important because they may affect the treatment plan and patient safety. 6. Clinical examination, which include extra and intraoral examination. First, extraoral examination. Examine all the structures outside the oral cavity, looking for facial asymmetry, swelling, lymph node enlargement, trismus, TMJ abnormalities. Record all findings clearly. Second, intraoral examination. Examine the structures inside the mouth. Assess oral hygiene, soft tissue, gingiva, teeth, presence of caries, missing teeth, mobility, swelling or lesions. Document all the relevant findings. Seventh, investigations. List any investigations performed, for examples, periapical radiograph, orthopentomogram, OPG, CBCT, blood investigations if needed. 8. Diagnosis. Based on the history, examination, and investigations, write the diagnosis clearly. For examples, chronic apical periodontitis, irreversible pulpitis, pericoronitis, root stump, impacted mandibular third molar. 9th, treatment plan. Write the planned treatment, for example, extraction of tooth number 48, surgical extraction for lower wisdom, incision and drainage, referral for further management. Mark the tooth number correctly on the dental chart provided. 10th, treatment record. At the bottom of the form, record date, start time, procedure performed, staff signature. Make sure all information is clear, accurate, and written precisely. At the end, conclusion. A properly completed case sheet is essential for the diagnosis, treatment plan, communication, and maintaining accurate patient records. Thank you for watching and attention.